All right, welcome to week 15, actually week 14 of Trends in Practical Nursing. This week we will be talking about leadership and management. This week, this information that we discussed today will cover chapter 12, 13, and 15. So let's get started. So we know that in 1965, we saw that Medicare and Medicaid passed different legislature, which changed the accreditation standards in our hospitals, our home health care settings, and also our long-term care facilities. Through that legislation and those changes in those standards, it was a positive thing because it created an overall rise in the demand that we see for licensed nursing service, which was a good thing. So we also saw a change in the scope of practice with our licensed practical and vocational nurses because how healthcare was funded changed. We saw this big push for those cost-cutting measures, but then we also saw an increase in the number of people that needed health insurance as well. All of those issues added to the changing scope of practice for those LPNs, and it allowed for leadership positions for LPN also to be added, which we did not have before. So in a variety of different healthcare settings, depending on where you work, we saw that these places offered new job titles for LPNs. So now LPNs can function as team leaders, charge nurses, care management. The thing to think about with these is that they can do this in any setting, but most importantly, the setting needs to be where the patient or the resident, if it's a long-term care facility, is relatively stable. The requirements for this specialized nursing care is going to be outlined in the National Association of Licensed Practical Nurses. So the clinical certifications that we see for LPNs is that they can get a certification in administering IV therapy. They can also get a gerontology certificate, and they can also get a certificate of long-term care. So for nurses, RNs, they also offer these certificates. So you might have heard in the clinical setting, nurses that are critical care certified, telemetry certified, med-surg certified, oncology certified. So these are the same type of certifications, but now they're available for LPNs. And these are the three that are available for the LPNs right now. So we talk about LPNs participating more in that leadership role that's been created for them. So when we think about a leader is someone who has leadership skills that can get other people to follow their vision or their plan in order to achieve some type of a goal that has been set. That leader is always going to be responsible for guiding that group of people to help achieve those goals. The person responsible for leading the team usually is called the care manager. The head nurse is also, you'll hear that in some settings, the charge nurse, most commonly we see in the hospital setting, or the team leader. We know there's different team approach delivery models to care. We talked about this very early on when you guys first started. So depending on what care delivery model you're using, that would determine what that team leader is called. So different than leader is leadership. Leadership is that process that helps that group of people achieve those goals. Leadership behaviors are very different from manager behaviors. So we know that there's different types of manager styles. So leadership, those behaviors are always going to be different. When we talk about like the authoritarian, that's just one type of leadership management, but they're going to be different. Usually leaders will have the ability to motivate other people. So a leader can be someone on your unit right now, if you guys work with someone or if you go to clinical, who doesn't have that role as a charge nurse. They're not in leadership, but they motivate other people. They adhere to a certain type of standard, and they have certain values that is ideal for other people, and other people follow them and look up to them, and they can almost create a vision for those other people. And we don't always see that with managers. So we do know that effective leaders have different styles that they use. They all can have very diverse, different personalities. They all have personal qualities that make them ideal to be leaders, and they can handle people in a dissimilar way. So the authoritarian leader, these leaders are primarily concerned with just the task at hand. So we're looking at a certain task and we just want to get that certain task accomplished. They order directives, and they give a lot of orders. They determine rules for the workers, and they independently make decisions that affect the entire team. So they're not really gathering that group. It's not that whole team approach. They're not sitting down with them and saying, what do you guys think about this? What can we do to make this? They are very independent, and they don't give a lot of, they don't get a lot of input from the people who work for them. And they usually dictate what the work is and how it's to be done. We have our permissive leader. They provide little direction to workers. They assume that the staff is going to be self-directed. So they assume that the people working under them know exactly what they're supposed to be doing, and they expect that they're getting it done. And they will do what needs to be done correctly and efficiently without any supervision. Then we have the democratic leader. So this leader will encourage their staff members to participate, and they will consult with them, and they will collaborate with the staff. Hey, this is a problem that we're seeing. X, Y, and Z is not getting done. We need to make some changes. What do you guys think would be an ideal way to handle things? What do you think we can implement? So there's a lot of collaboration with the staff that we see with the democratic leader. They will encourage participation in making those important decisions. And this leader will respect their team members and interact between them in a very open and trusting manner. You guys should go to page 261 in your book and see that leadership self-assessment activity. You guys should participate with that. So we know that knowing our personal characteristics of different styles of behavior is going to help us in our own practice. It's going to increase our awareness of our own behaviors, and it's going to help us identify changes that would hopefully enhance our abilities to be a leader ourselves. So when we talk about those behaviors, passive behavior, so some people that you work with may be considered passive people. So these people are going to come into work every day. They're going to stay in their lane. They're going to avoid any type of conflict, and they will not have anything to do in situations where an action is required. They just want to stay to themselves. They don't want to be caught up in any type of turmoil. They will never confront a situation or express feelings, needs, or wants. So if they're overwhelmed with their assignment, they probably won't say anything. They'll just take the crazy assignment. They will suffer silently. They won't get a lunch break, probably won't be able to go to the bathroom, but they won't complain about it, and they won't cause, any kind of a stir about it. These people can become angry. Obviously, they can be hostile, and they can blame others. They can say yes when they really mean to say no. Then we have aggressive behavior. So unfortunately, in any aspect of life, there is always going to be these people that you have to deal with, unfortunately. So aggressive behavior or aggressive people. So these people are going to be very pushy. It's their way or no way at all. They kind of know everything, and they force their beliefs and their opinions and their thoughts down everybody's throats. They're very, very forceful. They can be very hostile, and they certainly, when they're challenged, can be combative. They ignore the rights and feelings of others. They don't think about anybody else besides themselves. They focus on their own needs and their own feelings. And 99% of the time, they act and they speak before they think. They demand that they get what they want, and then they kind of have the approach of it's my way or no way at all. Then we have assertive people. So assertive people, assertive behavior, they will be open and honest, and they will express their needs or feelings, but unlike the aggressive person, they don't feel the need to attack them or to hurt other people. They're very confident. They use I statements when they're talking. They allow for discussion. So they're very open to other people's points of view. And they also they're capable of compromising. And they let others know what they want and what they expect, but they're always very respectful and very mindful of other people's feelings, which is really how everyone should behave. But unfortunately, you don't get that, not everybody has that trait. So you have to get used to working with people like that, but it can be a little bit difficult. So when we think about the qualities that we would like to see in an effective leader, so these people should be emotionally mature. They usually don't have temper tantrums. They don't pout. They don't complain, or they don't usually find fault. They don't usually speak loudly or joke inappropriately in the presence of patients or their visitors. They're pretty even-tempered, they're tolerant, and they're patient, and they maintain a very business-like atmosphere everywhere, especially in front of patients in patient care areas. They're very open-minded. They're very willing to listen to the suggestion of others. Because they're open-minded, they're able to look for better methods and safer procedures, which can be designed by other people other than themselves. And they frequently ask the opinion of others. They're usually fair, open-minded. They're critical thinkers. They are clinically very skilled. They're excellent problem solvers. They can be sensitive and objectives. They're very flexible with their leadership styles. They know when it's appropriate to have a sense of humor. And most importantly, they're able to learn from mistakes. So leaders are responsible for creating and encouraging the environment by being a positive role model. So they're always doing what is expected. They're carrying out those missions and those visions of the company that they work for. They motivate team members. They help them to achieve goals. And like I said, this isn't always your manager or someone that you think is a leader. It could just be another nurse who has the same job title as you, another LPN on the floor, but she's seen in that leader role because she has all of those qualities. She or he. They know the needs of the team. They know that unfortunately change is a way of life, especially in the healthcare field, because everything is evidence-based and things are always changing. They're very respectful. They remember to say please. They remember to say thank you, and they're very good at building other people up, and they give praise where praise is due. Being able to work together and build an effective team is going to require that part of that leadership role, they need to know that part of that leadership role is to build a team just as a coach builds a team. They have to recognize that each person brings something to the table. Each person has their strengths and their own weaknesses, and they have to recognize that in order to build that good team, that good solid team. So when we talk about management, which is different than leadership, management is going to be that coordination of all those activities associated with the delivery of nursing care. So being a good manager is going to require a combination of management skills and leadership qualities, which is why not everybody is considered a great manager, because they don't possess that perfect combination. So an effective manager will have great organizational skills, and they will make efficient use of their available time. You guys should take a look at page 275 and 276, do that self-assessment. We do know that a good manager must have experience, because without experience, you can't learn from your mistakes. You don't know what works and what doesn't. And then they also should be educated. They should have very strong clinical skills. They need to know where people come from, what they're doing. They should also know the skill level of each staff member. If you want to have expectations of people, like we said before, you need to kind of know their strengths and their weaknesses. You need to know what they're capable of. And then the nurse, the management skills, they will know the nursing needs of all of the clients on that floor in that that patient treatment care area. They should know which team member is most qualified to meet the needs of the clients. They should know how to communicate assignments to the staff. They have to use tact and firmness when handling difficult situations, and they should always be objective when they are evaluating the work of others. So there's 3 levels in management. The first level is going to be that team leader, that charge nurse, or the manager of a said patient care unit. Then we move into that second level. We can have supervisors there. Maybe this is going to be where we see your clinical specialists, and your assistant director of nursing would be in this second level. Then your third level is going to be that chief nursing executive, that chief nursing officer, the vice president for nursing, and the director of nursing. Oops, that does not belong down there. Sorry, let me move this actually. Oops. Sorry, guys. I don't know how that slide got moved. Oops. That in there. Okay. All right. Where was I? Okay. So when we think about the levels of management, let's see. So we know that LPNs, VNs they can now work as first level managers. They do recommend that if any LPN is considering some type of a management position, they really want to see that they have at least a year or more of that full-time clinical experience as a staff nurse. Most states require practice under supervision of either the registered nurse, the primary care provider, also a dentist, depending on what field you're in. And that they should, like I said, have that 1 year or more full-time clinical experience. They also, things that they will do when they're managing the unit is they will order supplies and equipment. So the unit manager is going to be responsible for having all the necessary supplies that his or her staff member needs to deliver that quality of care that is expected. So we want to make sure that we have equipment ordered. We also want to make sure that if we need flushes, we have flushes, we have needles, we have chuck pads for the patients, lab equipment, all the necessary things that we need. We want to make sure that the equipment that we have is in good working order. We want to make sure that when things are delivered to the unit, that we promptly put all them away where they belong so that the staff can easily find them. We want to make sure that all of our drugs are handled properly, that they're in the appropriate places. We want to make sure that in between patients and whenever necessary, that we're keeping our equipment clean. We want to decrease the risk of infection. And we want to make sure that everything is not a hazard, that it's in good working order. If anything isn't working, we should have a protocol in place that you bring it up to the secretary, you label it, it goes here, it goes there. So you should have all that stuff in place. You want to make sure that you're avoiding waste. So you really need to talk about to your staff about, little things. Like, do you have a patient who's on contact precautions? Well, we probably shouldn't be taking in extra supplies to those rooms unless we need them. So what we see sometimes in the hospital is that there'll be a whole bunch of flushes, or there'll be a whole bunch of IV bags or linens or things like that that go into the patient room. And when they're on contact precautions, we can't really clean them and use them again. So that's a form of waste. So we want to make sure that we're avoiding waste. We want to make sure that they're, depending on where you're working, if you're responsible for this, that you're billing correctly and appropriately. And then you want to make sure also that you're evaluating your spending. So every unit or setting has a budget. So you want to make sure that you are meeting the needs of your unit, ordering all the things that you need, but you want to make sure that you are adhering to the dollar amount that you have and not going over to that amount. And that's where avoiding waste comes in. You also have to make sure that you are maintaining a safe environment. So you're always looking out for you're looking for unsafe situations and making sure you take care of them. So are there a lot of oxygen tanks that are stored on the unit where they're not supposed to be? Are there wheelchairs just sitting out in the environment somewhere where a patient or somebody else could trip over them? Things like that. We know that carelessness contributes to injuries, so you always want to make sure that you're talking to your staff about, preventing needle sticks and leaving those things on the unit, making sure that the patient rooms are safe for the patients, that they have their bed alarms on, those high fall risk bracelets, those non-skid socks, bed locks, things like that. We also know that there is violence in the workplace that can affect nursing and patients. So violence can come from staff to staff. It can come from patients to staff, staff to patients. OSHA, there are safety tips that OSHA has designed for hospital workers on the internet. You can always go to their website and see that. And then a good rule of thumb is always making sure safety first is the rule on your patient care unit. You want to prevent those injuries to patients and staff. So another job duty is going to be communicating with visitors. So we know that HIPAA prevents us from giving out that confidential information to the wrong person. So we want to make sure that if we are giving information to a family member, we're always pulling up that chart, making sure that the person that we're giving that information to is listed and that it's appropriate. If you think that there's any change in that, always make sure you touch base with the patient and see if they've authorized you to talk to this person. At times there is, unfortunately, we do have disruptive visitors in the facilities. So of course, we're always going to try to attempt to have cooperation with these patients. Sometimes that's just not enough. You have to notify the nursing supervisor or security, and you have to kind of gain their help as well to ask for assistance. We know that we are going to have to communicate with supervisors. So the nursing supervisor on the unit is ultimately responsible for the quality of nursing care that is going to be provided by you and the staff. So the supervisor on the unit should also act as a resource person. Your staff should feel comfortable to be able to go to them. This person should be skilled enough and have that experience to be a good resource on the unit. The supervisor needs to be informed of any problems that occurred on the units, any incidents that occurred. If there were any incidents or any errors, we want to make sure that they're reported to the supervisor, but then depending on what happens, we always want to make sure we have a complete written description of any negative type of an incident. That could be an employee to an employee. You might have to, write up an incident report. If a patient fell, there's incident reports about that. Just depends. Present facts clearly when you're talking. Don't get into this he said, she said. Always just make sure that you state the facts. You should be very concise with the information that you're giving, and you should most certainly be objective. So we know that another role of the manager is going to be commuting with those primary care providers. So they're going to be working between the nurse and the doctor, the physician assistant, the nurse practitioner, speech pathology, physical therapy. She does communicate between all those primary care providers. She's going to make sure that those primary care providers are informed of that change in patient's condition. He or she can verify any unclear or questionable medication orders. And they can decipher nursing information that may influence the decisions the decisions for treatment. They also communicate with other departments. So EVS, so the people who are responsible for cleaning on the unit, distribution, the people who deliver supplies, there's a whole lot of other facilities, a lot of other departments that the manager communicates with. Not just the manager, but you in general as staff should always be respectful of the people that you work with. You should be very courteous and you should be very polite. Be sensitive to what other people are saying, be very patient and understanding, and then avoid blaming. Conflict resolution. This is something that we see in almost every workplace. It's going to happen, whether we want it to or not. We're going to be presented with different situations that we have to come up with a resolution for. So if things are occurring on the unit or in the workplace, if things are occurring and they're allowed to continue and they aren't dealt with at that time, then it allows the work environment to become very toxic. So you want to make sure that you're recognizing opportunities to recognize people that are toxic, that are creating these environments, that have these bad, these unacceptable, I don't want to say bad, but these unacceptable behaviors, aggressive behaviors, hostile behaviors, bullying behaviors. That's just to name a few. There's a lot of other different behaviors and a lot of other conflicts that can arise. But if you let these things go, it kind of empowers them, and then it can lead down, it can trickle down into the other people that work on the unit, and it can become very toxic. So it can negatively affect other people. One, that they don't want to be around those type of people, and then they might not want to stay at that job because it's an uncomfortable environment, or people that weren't toxic before can become toxic when they're around people that are spreading, things that aren't true, things like that. So the first step in being able to resolve any type of conflict is to make sure that it's a mutual problem and it's not just your problem. So is this happening with other people, or is it just me? Next, you have to practice active listening. You want to listen to what other people have to say. So, one person may say this, but 5 other people may say this, and it doesn't really align up with what the one person said. So maybe what the one person said isn't really factual if 10 other people are coming behind them and saying, well, this is the way that we saw it. You always want to make sure that you're listing the facts. Be objective. Don't include all the stuff that's not necessary, because it's easy to get caught up in that. So just listen to the facts. And then you want to examine work issues, not personalities. The most effective tool in reducing conflict among coworkers is to practice fairness, good listening, and communication skills, and respect for others. Fairness is a very important thing. I see this with a lot of different managers. It's not always easy to be fair. But if you do, it just makes things a lot easier for everyone. All right, so delegating nursing duties. So we know that part of the job that you do includes being able to delegate things that can be delegated. So ultimately, meeting the needs of the patients is going to be your responsibility. There are things you can delegate, but you have to make sure that they are things that can be delegated. So a licensed nurse is accountable for the appropriateness of delegated nursing tasks. The best way for that nurse to avoid being sued for negligence is to constantly look for and correct situations in which a patient may suffer from an injury. And I feel like part of this involves you looking at who you're dealing with that day. So sometimes I go into work and I know I'm working with a very strong patient care tech. I know her work ethic. I know that when she tells me she's going to do something, she does it. I still always double check, closer to the end of the day, to make sure that my vitals are in, and that if she said she was going to do something, she did it, because ultimately I know I'm responsible, but some people require you to stay on top of them a little bit more. So being able to identify that, if you can, is important, because then you have to put in more work to follow up and make sure that things are done the correct way. So if you tell the patient, can you go get these vital signs for me? You have to know that they are capable of doing that. Is it in their scope of practice? And are they capable of doing that? Are they going to do things in a timely manner? Or is this one of these people who, she'll do it, but it's probably going to be in like an hour from now? So we have to remember the 5 rights of delegation. So we have to remember the right task. So is this something that you can delegate to them? So if you're saying, can you go to Mrs. Jones's room and evaluate if her blood pressure is still high? That would be incorrect. So the tech cannot evaluate if the patient's blood pressure is still high. You can ask them to get a set of vitals for you, but then you would have to make sure that they did those vitals. So is it the right circumstance? Is it the right situation? Is it the right person? Are they able, is this a person that can do that task? We also want to have the right direction. We want to have the right communication with our person that we're delegating to. And then we also have the right supervision and evaluation. So does anyone have to supervise this? Who's evaluating this? Planning, when we think about planning and delegating the care for our patients, usually what happens is they are, most places have like a written assignment sheet, or some places even have a board of what nurses, what LPNs, what techs are going to be assigned to that patient through the day. If you are making a patient care assignment, you always want to try and be very, very fair. So we want every person to have a fair assignment. So if you have 6 totals on your unit for that day, and you have 3 nurses, you probably should divide them up by each nurse. So each nurse would have 2 totals. You wouldn't want to give one nurse 5 totals and another nurse no totals. So you want to be fair. If you have 10 finger sticks on the floor, you don't want to give one nurse 5 of them. You want to try and also delegate them appropriately throughout your the nurses that you have. Same thing with your techs. You want to try and divide them up so that they have an equal acuity level of patients as well, because that way we know that all of our all of our patients will get a appropriate, should get an appropriate, they should be provided for. I can't even talk today. I'm so brain dead. If we make sure that we have a appropriate assignment, we know that each nurse or each tech is going to be able to provide the safe care that we want for them. When we run the risk of accidents happening and medication administration errors happening when we have one nurse who doesn't have an assignment that is appropriate. If the acuity is too high and 2 people are really, really sick and she's running between rooms, and then we have something going on with another patient, or there's so many finger sticks. So we really just want to make sure that everybody on the unit gets safe care, and we can help do that by making sure that our assignment is as fair as possible. And then we know that is a legal responsibility to delegate tasks according to what our state law says. Also thinking about what your staff capability is and the patient needs. So if you have a tech who is, according to your hospital, able to put in a Foley, but they've never done it before, you probably wouldn't delegate that to them. That's something that you would want to do yourself. So you have to think of, like we said before, really think about what your the staff members are that you're working with, what they're capable of doing. Delegating and cross-training. So we do try to cross-train people and make people as effective as we can. There's a lot of different things that play into that. Staffing is always an issue. If you're not always staffed, you can't always take that person to spend one-on-one time with them to train them. So there's a lot of different variances that add into that. Basically, you want to only delegate to that patient care tech if you know that the person is competent. We just said a couple of slides ago that ultimately you remain liable for that. Even if they didn't do it, you're ultimately responsible for it. Cross-training is performing jobs that are normally performed by others. And there are nurses that are trained to work in several areas. But then, like I said, there's a lot of things that come into that. Sometimes you can have the adequate staff on the floor and you can really give that time to train that nurse, but to give them the experience to working in those different areas and for them to be able to gain that good clinical experience because they're exposed to it time and time again. We don't always see that because of staffing issues. So again, when we talk about the delegation and the cross-training, so we know that anybody that's cross-trained to do other things is considered a valuable employee because they can fill in where others fall short. So we know that it's a valuable thing to have. They can work in several different areas, which means that they can save money. But everything that has an advantage usually has a disadvantage. So inadequate or poor quality training, like we talked about. And then we always want to make sure, if there's not the adequate amount of training or the quality of the training isn't, at the level that it's supposed to be, then we're going to see safety issues. And then, like I said, are these people that are cross-trained able to stay competent in these other skills if they're not doing it all the time? So that becomes an issue as well. And then we know that ultimately it's going to, cross-training and delegation is going to be based upon the nurse practice acts in our state or every person's state, and the competence to be able to perform those additional duties. Standards of care, we know that standards of care are guidelines that are set to help identify the appropriate levels of professional care. So what would we expect to see? What is the, what are our goals for our care? There are rules and regulations that define the care that's expected of professionals and the practical vocational nurses. And we know that there's a variety of different accrediting agencies and organizations that help develop those standards of care that we do adhere to. And we always, in addition to those accrediting agencies, we also have that employer policy and those policy manuals on each unit to ultimately refer back to. So when we think about our state of Maryland and LPNs, we know that in the aspect of that team relationship that they contribute to the nursing process, they can do work together for those focus assessments, the planning, the interventions, and the evaluation of care. Medications, they can give all PO, all intramuscular and subcutaneous injections. IVs are allowed, so you can give IV therapy, so infusion therapy, under the direct or indirect supervision of the RN. The LPN can administer these fluids, all IV medications except IV push. So you can push like normal saline to flush the IV, vitamin D, anticoagulants, antiemetics, and erythropoietic agents, but all the rest of the medications you cannot. You also are not able to triage patients, because to triage patients, you have to look at them and determine, you have to make decisions about the assessment. So you're not able to do that. You're not able to work and carry out the duties of a circulating nurse, which we would see in that intraoperative nursing area. You cannot do the initial comprehensive nursing assessment on a patient. You cannot serve as a nurse case manager. You have to be supervised under an RN, so you cannot supervise another RN or an LPN, and you're not able to analyze patient data to determine a nursing diagnosis. So quality assurance, peer review, and risk management programs, we've talked about this over the past year, and we've talked about it this semester. So this should be a review for you guys. So we know that quality assurance is going to be responsible for setting those minimal standards of care that we would expect to see. Quality improvement is what is developed to intend to help an organization move beyond those minimal standards. So we don't want to just deliver the minimal. We want to improve that, and we want to have higher standards of care. So that's where we're going to see quality improvement. And continuous quality improvement is a term that we see people use to describe that overall plan that they're using to help improve that quality of care. And it includes quality assurance and quality improvement. Peer review can be described as the examination of someone else's work by other people of equal standing. So you'll see in some of the literature that you guys have been doing with aspects to like APA and the different, when you're doing your projects and papers and things like that, we're always talking about these peer-reviewed articles. This is what peer-reviewed is. Risk management are programs that have been designed to help prevent loss to that financial institution or to that organization or to that care facility. So their job is really to look for potential problems and put measures into place to prevent them. And then we know that the purpose of quality assurance programs in healthcare facilities is that they go in, they they evaluate, and they improve the level of service that we're providing to those patients. And we want to make sure that it is at least minimally accepted levels of service at the lowest cost possible. All right, so work-related challenges. So we know that ideally in the perfect workplace that our social environment and our cultural environment would be very fair and supportive. That's what we want. We want all of our workers and our patients to feel safe from injury and harm. We want to make sure that our physical environment is always efficient and comfortable, and that our coworkers practice healthy behaviors. But we know that not every workplace is healthy for a variety of different reasons. Sometimes they're never healthy. Sometimes they go in waves. You know, sometimes they have the greatest staff. Everybody's a good team player. Everybody fits. Things work appropriately, but then people leave, go here, go there. You know, these units go through a lot of changes. These facilities go through a lot of changes. One of the things that we see that can cause work-related challenges is an abusive environment. So this is a person that works in the environment that feels threatened or intimidated by either their boss or another person that they work with. We know that when people are involved in abusive relationships, it's going to reduce the ability of these patients to work at their highest levels. They're not going to be highly productive people. They're not going to be your best employees because it takes a toll on them. We always want to encourage healthy environments. We want to identify these people who are responsible for these abusive, who are, you know, intimidating people or bullying people in the workplace. And we want to encourage people and let them know that we're not going to tolerate that it's a zero tolerance. And we want people to feel like they can come to the management, they can come to human resource, and that they can provide written confidential complaints, and that their thoughts and their feelings will be heard and that it'll be addressed. Whistleblowing is when a person reports unethical or illegal workplace practices to the employer. It could also be a government employee or the public health in general. But in order to for anything to really be looked at, there has to be a sufficient documentation to be able to substantiate their claim. We just can't say, this is what we saw, and this is what's going on. And then there are laws regarding whistleblowers. You guys can take a look at that in your book. Whoops. Sorry, guys. So bullying, we talked a little bit about that. Bullying is an aggressive behavior that is intended to either hurt another person or to gain some type of a power. So workplace bullying, there was a workplace bullying survey that revealed that approximately 72% of bullies are bosses and 37% of them are coworkers. So if you're a target, you need to know that you can seek help from human resources. Violent attacks. So when we talk about violent attacks, we're talking about stalking, domestic violence, physical assaults, threats of assault that can be directed towards people at work or people that are on duty. There are measures put into place there should be anyway, through all your types of employments that it discourages these employments, and there should be certain channels that you can follow up with to make sure that these things aren't occurring. And then we also want to think about diversity. So we know that diversity is going to refer to the similarities that we have between each other and the differences. So we want to think about our age. So there's always the older coworker versus the new person that just graduated, that's just fresh out of college, you know, in their early 20s. We have a variety of different cultural backgrounds. Some even have disabilities. Our spirituality can be different. Our religions, we know, are very different. Our races, our gender, our sexual orientation, our genetics, there's a lot of different things that contributes to all of us being very diverse. So we want to make sure as an employee that we are valuing and appreciating the differences in each of us, as well as our clients, and that we are appreciative and respectful of that. There is the American with Disabilities Act that prohibits any type of discrimination and ensures that there is equal opportunity for people with disabilities in every avenue of employment. We know that there are occupational challenges, so stress. Stress is that emergency response we see to a threat. It's our fight or flight. Stress can cause us to feel frustrated and angry. It can cause us to feel like we don't have a lot of control over certain situations. There is a very high potential for stress in the nursing occupation. So if you do not deal well with stress, this is probably not the occupation for you. There's a lot of stress in nursing. You should be able to look at yourself, do those self-evaluations, learn the symptoms of stress, learn how to manage stress. We've talked a lot about that through this last year, then letting it affect you. So really doing that self-evaluation at the end of your shift. How do you feel? What do you think contributed to that? How can you make changes to that? What can you do to make sure that you have a different day? And you can become skilled in really applying those effective coping strategies. Burnout is something that we hear about in nursing. It happens all the time. We've seen it a lot, unfortunately, since COVID. COVID has caused a lot of negative effects on the nursing field. So burnout can create a sense of hopelessness about your job. We see that this can happen because of chronic stress. It definitely decreases our job performance, how well we perform. We know it also carries into our personal life once we get home. We know that burnout is caused by our very highly stressful working conditions or relationships, and an inability to be able to match what they expect of themselves to what time and conditions let them deliver. So this is something, to me anyway, that really stands out, and I see it with all the nurses that I work with. I feel like sometimes because of, you know, all the things that we've talked about today, especially staffing, sometimes what they expect of us to do and what we want to do for our patients compared to what needs to be done and what time we have to do it can be a huge issue. I mean, many times I leave the day going home feeling like I gave subpar care. Did I probably do that? No, because I have such high expectations of what I should do. I know that they always get the appropriate care, but I always want to deliver more. I know what my own expectations are. But if I don't have a tech and I have 6 patients instead of 5 or 7 patients instead of 5, I'm only one person. I can only do so much. So when you're in that situation for a long period of time, it can contribute to burnout. Compassion fatigue. This is something I used to see a lot of on the oncology unit. This is not just the oncology unit, but I noticed this there. It's, you know, compassion fatigue is caring too much, which results in physical and emotional and spiritual exhaustion. It can also cause you to make mistakes and decrease your job performance. We also see that a lot of morale on the unit can drop when these people are exhibiting compassion fatigue. Personal relationships at home and at work can be affected, and we can see changes in their personalities. And then violence. So we see that violence can be coworkers that exhibit that bullying behavior. It can also occur in emergency rooms, psychiatric units, high levels of violence there. Waiting rooms when people are tired of waiting and they get angry. Geriatric units because they might have dementia, they may be confused. So you want to make sure that, you know, when you're faced with these challenges, that you're using a behavior that can help diffuse the anger and not add to it. So you always want to try as best as you can to remain calm. Always talk to people with a calm attitude, always acknowledge their feelings. Even if it's not something that you agree with, they're very passionate about it for a reason. It's the way that they feel, we have to acknowledge it. Try and avoid aggressive behavior. There's always those people who try and trigger other people, you know, and try and get them to be aggressive. So avoid those people, avoid those behaviors, and use ingenuity to help get help. Health risks, we know that OSHA has developed guidelines that we should be following to prevent certain occupational hazards at work. So we know that nurses rank 10th for musculoskeletal injury. So we need to work smart. We need to make sure that if we have a tech that can help us roll a patient, that we get them. If we need 4 people, we get other nurses. Raise that bed. Make sure that you're working ergonomically correct. Make sure you're wearing those TED stockings. Exercise, take care of yourself. Make sure you're paying attention when you're doing those injections. Try and prevent those accidental needle sticks. Wear those gowns and gloves and masks and shields when you're supposed to, prevent those infectious diseases. Make sure that you're handling chemical radiation and certain drugs the way you're supposed to, according to certain protocols. If you're unsure, you should be referring back to your policy. Environmental toxins, again, make sure you're following the protocols when you're handling these toxins, and then obviously follow all your hospital or your facility recommendations, their policies and procedures and precautions. Terrorism, we know, is something that we've been dealing with over the course of many years now. So terrorism is the use of force or violence against a group, a society, or a government with the potential for harming large numbers of people. It can, when we see an act of terrorism, it can cause a huge influx of people into our healthcare facilities and really overwhelm those facilities and resources. We do have emergency prepared training programs that have been put into place. Usually they are offered by your employer and different community groups so that you can kind of anticipate these acts and kind of have a general idea of what to do when you're faced with one of these situations. And then bioterrorism is the intentional use of microorganisms to bring about ill effects or deaths to humans, livestock, or crops. Again, depending on what it is, there's varied methods of transportation, contact, inhalation. Standard precautions and additional appropriate precautions should always be taken to avoid exposure and contamination. Emergency preparedness, this is involving the planning for that public health emergency. So reacting those, having those mock drill disasters. I know we have some at the college, doing the same thing in the hospital. Usually healthcare facilities do them, federal, state, and local agencies also do them. The best response is to use common sense to try and remain calm, think critically, and follow the instruction of those in charge. This can be a very scary time for a lot of people, especially people that are providing care to other people. There's a lot of unknowns. So practicing them can help you. The nurse's role with these challenges is to continue to learn. You should continue to learn about public health emergencies. You should think about how they can affect you at work. How can they affect you and your family? What can you do to better prepare for them? Consider being a volunteer, participate with these different mock and disaster drills that they have so that you can always feel like you're prepared. We know that there's a lot of different toxic substances that we can be subjected to in our environment. So those anti-neoplastic drugs, those cancer drugs, certain antibiotics, anesthesia gases. Some of our medical equipment gives off mercury gas, which can be dangerous. Disinfectants that we clean with on the unit, certain plastics, latexes, just the pollution in our air and different biological materials. There's a lot of different toxic substances. In the hospital, there should be an MSDS sheet, which is a material safety data sheet. You should know where that is in your hospital on each unit. It's going to include all those first aid measures that should be performed according to which drug which toxic substance you're dealing with, what you should do if there's an accidental release, how do you handle the substance, how do you clean it up, how do you dispose of it. All that important information is going to be in that MSDS. Sorry, and I think I forgot to change the slide. Sorry about that. Some people are subjected to radiation. Some people work in the radiation department. Some people care for patients who have been treated with radiation. We know we use radiation to treat disease, to diagnose certain things. Uncontrolled exposure to radiation must be reported and treated immediately. So If you found yourself being exposed to radiation any of the ways that I talked about or any other way, you would want to make sure you immediately report that to your supervisor. There should be an incident report filled out. You should go to employee health. And if it's deemed that you need any treatment, you should make sure that you have that done. Pollution can come from medical waste. Like I said, there's a lot of environmental toxins. We should just make sure that we are always following our policy and procedures for our facility. We want to make sure that we comply with procedures for recycling and reducing waste. And we know that we've talked about a lot of different challenges in our workplace today. We can help diminish those challenges by using those good communication skills that we talked about, being actively involved, looking at ourselves, looking at our environment, trying to prepare for the unexpected, and then practicing those self-care activities. And that is it for your last lecture for NURN 115. If you have any questions, you guys can